My name is Laurentiu Givelichian, and I'm a neonatologist and a pediatric critical care specialist at Jim Pattison Children's Hospital in Saskatoon, Saskatchewan, Canada. For as far as I remember, I have been fascinated by the action-packed activities in the emergency room and ambulances with their lights and sirens on. All my childhood friends were attracted to action heroes. I was attracted by physicians and ambulance attendants who were saving lives. For more than 2 decades, I've tried to improve the quality and delivery of healthcare to the children of Saskatoon, Saskatchewan, and to some extent to the rest of Canada through my previous administrative roles. Most people know me by Dr. G, as my last name is a little bit harder to pronounce. But many people know me by a phrase that I've been repeating over and over again. All the children of Saskatchewan deserve the same level of health care regardless of their postal code. I've dedicated most of my career to taking care of the sickest babies and children and advocating and driving the project known as Children's Hospital of Saskatchewan.
In the early 2000s, as a member of the Children's Hospital Foundation Board, Dr. Givelichian advocated for a children's hospital in Saskatchewan, as it was the only province in Canada to have a medical school but no children's hospital. The available literature showed that children treated in children's hospitals had better health outcomes and were able to return home sooner if they could be treated by specialized personnel and physicians. After several years of advocacy and lobbying the government, in 2007 the construction of a children's hospital in Saskatoon, Saskatchewan was approved, much to the delight of Dr. Givelichian and his fellow physicians. In 2010, he was part of a meeting to decide the location of the new hospital, and there were several considerations to ponder when making this determination, including minimizing transport time for sick and injured children and calculating the distance of the hospital site from subspecialists in children's medicine, as well as expectant mothers. The decision was made to include maternal services within the children's hospital, which would eliminate the transport time needed to transfer infants from the maternity ward to neonatal intensive care.
When we talk about the design of the Children's Hospital, we made sure that we survey children throughout the entire province. We ask specific questions. What would they like to see in a hospital to make them feel more comfortable? Their answers were very clear to us. They wanted to see animals, birds, and plants that they will see in the places that they are coming from.
The design of the hospital was tailored to patient needs, to create a home-like environment and to deliver a state-of-the-art family care center on its main level. For example, the hospital has a 28,000 square foot area for therapeutics and play, including a pretend MRI and a pretend ambulance to help children understand what these pieces of equipment mean and to help them feel more comfortable around them. To facilitate easy navigation, the pediatric outpatient clinic is divided into 4 animal-themed pods: moose, prairie dog, frog, and fox pods. There are 5 graphical themes within the hospital: the forest for the main floor, the lake region for the children's emergency ward, the north for pediatrics, the prairies for maternal care, and new season for the neonatal intensive care unit. The design also includes single patient rooms with their own bathrooms and murals on the walls depicting birds, animals, and plants.
Once the announcement was made for a children's hospital, it became very clear to all of us that we need more resources, more physicians, more teams. We needed to make it extremely attractive for these physicians and their families and their teams to come to Saskatchewan.
Recruitment drives were held throughout the region, and one of the phrases that Dr. Givelichian was best known for at this time was, "All the children of Saskatchewan deserve the same level of care, regardless of their postal code." In early 2013, as a chair of pediatrics, Dr. Givelichian started an initiative with one of the hospital's partners in the Department of Surgery. This initiative dispatched surgical robots to the most remote parts of the country, where it was very difficult for medical care providers to reach patients. The robots could be controlled through smartphones or any other device and gave visuals of the patient. They also enabled the surgeon to have conversations with the patient's families. By using this technology, the medical team was able to avoid airlifting multiple patients to tertiary care units by treating them on site. In Dr. Givelichian's opinion, this is the best way of delivering health in the future for the rest of Canada and the world.
My plans for the future. I'll continue to work in neonatal intensive care and pediatric intensive care because my passion to improve the outcome of the sickest babies and sickest children is as strong as ever. I'll continue to be involved in philanthropy and philanthropy administration. It's becoming very clear that there are areas that really required more support, financial, and that one area that I identified is the parents and the families of the sickest children. We spend lots of money and lots of resources into admitting them to the hospital, treating them, but not too much was done regarding the comfort of these families and these parents.
Dr. Givelichian's goal is to address the void that still exists today in healthcare. He feels that not too many people understand that 2/3 of the cost of medicine is usually absorbed by the government in Canada or any insurance company in the United States. But 1/3 of the cost of the healthcare provider is still going to be covered by philanthropy or donations. Dr. Givelichian is also involved in starting a podcast to bring to public knowledge some of the insights identified in his career to educate the listeners.
I'd like to continue my endeavor to obtain my pilot license. My hope is that I'll be able to fly to the most remote areas and treat children there. Next to me, I have my coffee cup that has the name of the plane that I did my first solo on, and it's Foxtrot Zulu Papa X-Ray. On January the 22nd, 2016, Saskatchewan and Canada witnessed a tremendous tragedy. Was the Lolache High School shooting. 4 children were dead and 7 others were injured. That community suffered a tremendous amount of physical and mental health, and every child that was attending that school was affected. Reopening the high school became a very high priority for the government, but also for us as healthcare provider in pediatrics. We knew we had to offer more than just to reopen the high school. We had to offer the kids a place where they will feel safe and they will want to come back to school, but also a place where they can see a doctor. This is when the new redesigned high school reopened in 2019, this time including 2 pediatric clinics, where children will come and be seen by a pediatrician, but also will attend school. Another historical moment I was extremely fortunate to witness was in December 2016, when a group of us from the Children's Hospital Foundation traveled to Vancouver together with the Minister of Health in order to decide the naming of the new Children's Hospital.
After a presentation to the board of the Jim Pattinson Corporation, the Children's Hospital Foundation has been offered a $50 million donation to name the Jim Pattinson Children's Hospital of Saskatchewan.
It is important for the public and for the next generation, for my children and their children, to understand the stories behind successes. And in my mind, Jim Pattinson Children's Hospital is one of these historical successes for children's health in Saskatchewan, in Canada. This hospital will stand tall on the Saskatchewan riverbank for many, many years to come. The more educated people are, the more success stories will be born. Who's Who is helping exactly with this to bring the stories to the front line. There is also a legacy piece that is very rewarding, knowing that my hard work has been captured on all the platforms offered by marquee Who's Who.